to shout or anything because you're far away.
Hey, good afternoon, everyone. Thank you all for joining us today. Before we begin, just a reminder to those who have joined by phone, please keep your phones muted until after all our speakers have presented. Once the briefing is over, we will be taking questions, but again, if you could please keep your phones muted until then. Thank you. Today, we'll be hearing from County Executive Armin Budish, Board of Health Commissioner Terry Allen, Board of Health Medical Director, Dr. Heidi Gullett, Board of Health Co-Director of Prevention and Wellness, Ramona Brazil, and Assistant Professor for the Center for Community Health Integration and Director of Preventative Medicine Residency at East-West New Jersey University School of Medicine, Dr. Johnny Rose. So we will begin today with County Executive Armin Budish. So please go ahead, Armin.
Thank you very much. Hello, everybody. Thanks, as always, for joining us for these weekly updates. And thanks to Director Terry Allen, Dr. Heidi Gullett, Ramona Brazil, and everyone at our County Board of Health for their great efforts to keep us safe and informed about COVID. I want to start off with a personal note by acknowledging that today at sundown, Jews all over the world celebrate Rosh Hashanah, one of the holiest days of the year. This year, I'm so very grateful that those that I love are healthy and safe, and that my wife Amy and I are actually going to be able to gather with my son and his partner for a socially distanced dinner tonight. The COVID crisis shines a light on what matters most, our loved ones, our health and our safety and security. Rosh Hashanah is all about looking forward, and I know we all hope for a better year and a better future. Traditionally, the foods we serve represent these wishes. My wife, Amy, has spent most of the week cooking. I'll tell you, the house sure smells good when I get home. This year, she's serving turkey with a pomegranate gravy. It's said that each pomegranate has 613 seeds, each one a symbol of good acts to do for others, or mitzvahs. So the expectations are high. I take this obligation seriously. In fact, it's why I entered public service in the first place, to do good and to help people. One of the most important good acts that we've worked on since the beginning of my administration is making sure that people can get jobs, not just any jobs, but jobs that provide a living wage so that people can support themselves and their families. We've developed a comprehensive approach to helping connect businesses with job seekers. Our efforts resulted in a program called Workforce Connect, which focuses on helping people get jobs in manufacturing, healthcare, and information technology. Thanks to the work we've been doing, Governor DeWine chose us to become the pilot county for his new Ohio to Work initiative. We're partnering with Ohio Means Jobs Cleveland Cuyahoga, Goodwill, and the Urban League to serve 4,000 job seekers. The goal is to fill at least 500 good positions during this pilot phase. This program will supplement our other workforce initiatives like Skill Up and virtual job fairs. At the end of last year and the start of this year, we had succeeded in bringing our unemployment rate way down to around 4 or 4.5%. COVID, though, hit us very hard, and our unemployment rate is now about 13%. So we can certainly use all the help we can get. We want to help you. So go to ohiotowwork.com and learn about training options. There are 14 training providers and more than 50 employers who have agreed to participate in this new partnership. We can help you get the training you need, and we can connect you to a job. Now, I want to switch to another bad impact of COVID. Domestic violence is rising again, and we want to help. U.S. Attorney Justin Herdman just announced awards of more than $2.3 million to Northern Ohio organizations to help reduce violence against women and to strengthen services to victims of domestic violence, dating violence, sexual assault, and stalking. Cuyahoga County just received a grant of $824,000 from U.S. Attorney Herdman for our Domestic Violence Homicide Prevention Initiative. Since 2016, our Witness Victim Services Center has led the U.S. Department of Justice's Domestic Violence Homicide Prevention Initiative, along with the Domestic Violence and Child Advocacy Center and the Cleveland Police. Throughout the course of the project, over 800 Cleveland police officers have been trained in the use of a danger assessment tool that's used at the scene of a domestic violence crime to identify victims of intimate partner violence who are at heightened risk of homicide. High-risk victims receive specialized services from a court advocate and a dedicated police detective. With Cleveland having the highest concentration of domestic violence crimes in the county, the initiative was piloted in the city's police districts 1 and 5. Now, with this new funding, we'll be able to expand the program throughout the city and the rest of the county. This is important, life-saving work, and I'm so grateful to U.S. Attorney Herdman for his recognition and his support. Having funding to allow for critical service delivery is what allows us to serve people in the county. That's why getting an accurate census count is so incredibly important. For every person who doesn't fill out the census, we lose well over $1,000 a month, and that adds up. If we don't get a good count, we stand to lose billions of dollars over 10 years. Now, that's not money for county government. It's money that goes directly to services for the poor, the young, the elderly, the most vulnerable of us, and it's money that goes to repair the streets and roads in our communities too. I want to thank the TV and radio stations who did a big push last week to get the word out about the census. I'd like to specifically thank WKYC, WEWS, Fox 8, and WOIO, as well as iHeartRadio and Radio 1 for their great and strong support. Since last week, our count has gone up more than a full percentage point, which is big. That really demonstrates the power of the media to make things happen. As we near the end of the count, we've worked with the Complete Count CLE Coalition to launch an ice cream challenge. We'll try anything to get the census up. The mayor of the community with the greatest increase in census completions through September 18th at 5 p.m., which is today, will receive $500 in Honey Hut ice cream to deliver to the nonprofit of their choice. The mayor of the community with the greatest growth in responses through September 30th will receive $2,000 in ice cream to deliver to the nonprofit of their choice. Here's where we stand right now. Bentleyville continues to hold the lead, raising their response rate by 2.8% this month. But Oakwood and Cuyahoga Heights are close behind. So let's all keep it going. Finally, I want to talk about our county library system. We have the #1 library system in the country, one of our most valuable assets. The pandemic has caused so much disruption, but our libraries have been a safe and secure haven for so many services. The libraries are so much more than books, and we in county government have a great partnership with the libraries. For example, the library is currently partnering with us to help distribute computers and Wi-Fi hotspots to families in need. which is especially important to connect kids to the internet during this unusual school year with remote or hybrid learning models. If you need Medicaid for healthcare or SNAP for food, you can go to your neighborhood library to apply without having to make a trip downtown. If you want to get your GED or start a business, the library can help there too. These are just a few examples of the critical role the county libraries play in our communities, especially during a pandemic. That's why it is so crucial that we support the library levy on the ballot this year. Issue 70 is the number. It will ensure that our libraries can continue to operate its 27 branches, which are open 7 days a week, and maintain important virtual services. So on this Jewish holiday, I wish you all the best in the world. I hope we can all continue to join together to do good in the world to make this new year a better one for all of us. Thank you very much. And now it's my pleasure to turn it over to Director Terry Allen.
Thank you, Executive Budish, and wish you the best on Rosh Hashanah to your family. We appreciate you, as always, championing the prevention message during this pandemic and for your enduring partnership and your support. Today, I'm happy to be joined, as Miranda noted, by our Medical Director, Dr. Heidi Gullett, who will review the data brief as well as some testing issues. Our Co-Director of Prevention and Wellness, Ramona Brazil, will discuss our COVID-19 case reporting in schools and some related issues, and Dr. Johnny Rose from Case Western Reserve University, who came to us 10 years ago as a preventive medicine resident and who was integral in the development of the new school reopening guidelines that we released this past week to the community and to the school districts. Yesterday, Governor DeWine announced that Cuyahoga County remains at risk level 2 public health emergency, or orange, in the public health advisory system for what I believe is now the 5th week in a row. Counties at risk level 2 are advised by the Ohio Department of Health to exercise a high degree of caution. This is quite an achievement to be at risk level 2 for 5 weeks. And the credit goes to everyone in our community, everyone who has embraced the power of public health prevention during this pandemic. So this continues to be good news and an indication that our community is still moving in the right direction. Over the past few weeks, we've been reviewing the evidence base, the current science around best practices for the safe reopening of schools in our community. And Dr. Rose will speak in a few minutes about these guidelines, which were shared with the school community and the public last week. In fact, we talked a bit more about the guidelines with the school superintendents that we meet with on a regular basis just this morning. It's now very clear that our increasing mask use, following the physical distancing guidance, implementing remote work options, promoting hand hygiene, surface cleaning, and staying home when you're sick are all working. It's absolutely clear now, and the evidence is shown in our data and our positive movement here in terms of our case trajectory relative to the COVID-19 pandemic. We need to continue to follow the playbook and do our part to keep our community safe. Our continued vigilance is our way out of this pandemic. We know we're not out of the woods yet. The flu season and the release of a vaccine for COVID-19 are still ahead of us, and we need to continue to remain vigilant and true to the prevention guidelines. As of yesterday, there were 16,907 cases of COVID-19 that have been reported in all of Cuyahoga County, including the city of Cleveland, with 15% of these cases, or 2,533 people, requiring hospitalizations. This is by far the highest number of hospitalizations in the state. Of the total cases, 3.7%, or 638 people, have died since March. You'll hear more from Dr. Gullett on the data specific to our jurisdiction. We know that this coronavirus spreads easily, and people without symptoms can unknowingly transmit the virus to others. And infectious diseases, we also know, do not recognize or care about borders on a map. The state recently released guidance for the reopening of senior centers and adult day centers. And so we've been working with our partners at the Cuyahoga County Department of Senior and Adult Services and the Senior Center Network to discuss reopening plans, testing requirements, and related matters to prevent the spread of COVID-19. All the members of the network of senior centers are clearly committed to do the very best to safely meet the needs of their seniors, and we appreciate their commitment and their collaboration. Back in May, the CDC released data indicating the adverse impact of the pandemic on childhood vaccination rates, which have decreased across the country. We know that pediatric vaccinations are essential to reduce the risk of communicable disease in the school setting. To address the call from County Executive Budish to do something about this negative trend and to address this reality in our community, the Cuyahoga County Board of Health has been holding drive-through clinics for back-to-school vaccination for kids to catch up. We've also incorporated flu vaccination into the drive-through setting because we are in flu season, the beginning of the flu season now. And as I said before, if there was ever a year to get your flu shot, this would be the year. You can learn more about these clinics by going to our website at ccbh.net so that you can get your kids vaccinated or get a flu shot. Pharmacies, hospitals, and community clinics all over the county have flu vaccination available, and you can go to fluvaccinefinder.org. That's fluvaccinefinder.org to find options in your area. So looking out the window today, I'm reminded every year at this time about how fortunate we are to have such great fall weather in Northeast Ohio. There are a wide range of health benefits to walking outdoors that include reduction in chronic disease risks and stress reduction. We can do this safely with others by following the prevention playbook. Now is the time to get outside and enjoy what looks to be a long stretch of seasonal sunny weather. So wrapping up and transitioning to Dr. Gullett, I'd like to take a moment to share my appreciation for all of our administrative support staff at the Cuyahoga County Board of Health. They're the oil that runs the engine in this pandemic. And in the response overall, and in the delivery of our public health programs and services, they are tireless, they are committed, and they are resilient professionals. And it's an honor to work alongside them every day. We owe a huge debt of gratitude for their service to our community. Thank you for your time and attention. And now I'll step away and allow Dr. Gullett to share the Epi data brief and related matters with testing. Thanks.
Yeah, I can't see anything. Thank you so much, Terry. We're going to take the next few minutes to walk through our weekly data brief, which is already posted on our website for public review. You'll note that Terry already talked about our full county data, which include the city of Cleveland, but we'd like to give you some additional information about data specific to the Cuyahoga County Board of Health jurisdiction. This week, we have cumulative, meaning cases from the beginning of the pandemic, at a little over 11,700. And you'll note that about 10% of those total cases have required hospitalization at some point during their illness. And almost 2.5% of those have required care in the intensive care unit, meaning they had serious complications of the COVID-19 infection. And both those hospitalizations and intensive care unit cases include pediatric cases as well as adult cases. This week we had just under 50 cases on average per day for the last 7 days. And that is an increase from the prior week, but it is substantially less than we had in the weekly counts from July and August. You'll also note this week that we had a report of an additional 26 deaths related to COVID-19. And again, we want to remind everyone that while it's easy to look at this data brief and see numbers, every single one of these cases and every single one of these deaths represents loss of life in our community. And it's really important that we continue to remember these families who have suffered tremendously during this pandemic. The current cases of individuals who've died from COVID-19 in our jurisdiction range in age from 31 years old to 104 years old. If you look lower on the data brief, which Jonathan is showing you now, you'll see our customary breakdown of male and female as well as age. And you'll see that we have about 10% of our cases to date in the pediatric range, with another 37% ranging between the ages of 20 and 39. And so over the summer, that's been pretty stable as far as the approximate average of the cases in there is the highest in that particular age group. You'll also notice that for the bottom of that first page, we continue to report out the percent overall of healthcare workers, as well as race, ethnicity, and those who have comorbidities or conditions that make them at higher risk. And each of those parameters, particularly the healthcare workers and the comorbidities or pre-existing conditions, have remained stable for the last few months. About a little over a third of individuals of all of our cases have those conditions. A third do not, and for about a third we don't know. It gets up a little bit higher when you begin looking at the percent of our cases that have required hospitalization. So more people that have been hospitalized and in the intensive care unit have had those pre-existing conditions than the 37% you see for our overall cases. If you proceed on to the next page, you'll see the traditional Epi Report, which we have been, the curve, which we've been showing you since March. You'll see a little bit of up and down over those first few months when we had the stay-at-home order, and then we had our increase in July, which we've been showing you for a few months, and we are pleased to see this continued downward trend in the average number of daily cases. So you can see each of these bars represents one day and the total number of cases reported to us in that day. The far end of the curve, as we've talked about before, is incomplete because the data sometimes lag behind. So next week you'll see a little bit more complete for this week. Doesn't mean that we have 0 cases, as it looks like on the graph. And just below our Epi curve, as you know and you've come to expect, we have our map, which includes both our data from the Cuyahoga County Board of Health jurisdiction, as well as data from the city of Cleveland and our colleagues there. This, again, is a zip code map, which simply indicates where individuals who've been diagnosed positive with COVID-19 live. It does not indicate where they were infected or any elements of contact tracing. You will see that we continue to provide the number of cases in each of those zip codes. Finally, on the last page, you'll see our hospital utilization data, meaning how many of these beds in each of these categories are being used this week. And we've been trending this since it became available to us in March. And you'll see that the average of utilization, so the current utilization this week as of this morning for both ICU beds for adults as well as general medicine beds for adults, is pretty similar. We've been above 80%, in the low 80% range now for quite some time, as you can see on the graph. We did see pediatric utilization for regular pediatric medical beds to be a little bit higher this week. It's actually about 17% higher than last week. But as you can see, over the last 6 months, it's gone up and down depending on which week we were in. And we don't feel that this is reflective of increased COVID pediatric admissions. That's not really seen in our data when we look at it for the last few weeks. And then you'll see ventilator usage is also very stable at about 40%, as it has been now for a number of weeks. Finally, on the bottom of our Epi report, we provide weekly the total number of tests that were run between the 3 hospital systems in our community, Cleveland Clinic, Metro Health, and University Hospitals, who are running COVID-19 PCR testing, meaning testing to check for current COVID-19 infection. So that's what you see reflected here. This does not reflect antibody testing to check for prior infection. So you'll see that we had just about 18,500, just a little more than that, tests run between the 3 hospitals this week. And we're pleased that our percent positivity remains low, again, this week in the 3.4% range. And we wanted to also highlight that this is a very consistent percent positive with other available data to us. We now have the availability to look at nursing home percent positive data on the national level broken down by county. And this week for Cuyahoga County, that was at 3.2%. So we feel that even though this doesn't capture every test done in our community, because we don't have access to all of the tests that are done, we feel that these are good measures to give us a general sense that we're trending in the right direction with less positivity, which is what we want to see. Finally, in the moment of gratitude today, I would like to thank Dr. Johnny Rose, who you're going to hear from in a few minutes. Terry already mentioned him, and if you're a regular viewer of our press conferences, you have seen him present modeling data, which we continue to use on a weekly basis and are very grateful for, as it gives us a window into the subsequent 2 weeks every week. But I really wanted to thank him for the considerable amount of time he spent diving into all of the available evidence around how we can best work with our school partners to give recommendations for reopening. He did a really remarkable job of digging into research that came from all over the world. And I also wanted to thank the entire school team here at CCVH, who's working really hard on contact tracing and making sure that school-related questions are answered very quickly. So we're very grateful for all of you and your tireless work in that space. Ramona has been leading a lot of that work, and you'll hear from her next. And finally, I wanted to thank Andrea Zabo. She is a Case Western Reserve University School of Medicine medical student who spent 6 months of her year this year working very closely with us. She has never shied away from a challenge, always responded in everything that we ever asked her to do, and she actually created all kinds of workflows and creative ways to improve the response that we had, and oversaw dozens and dozens of medical students and physician assistant students who were aiding our response here for many months. Andrea is returning back to her clinical duties, and we are happy to cheer her on in that capacity, but I couldn't let a moment go by to really share my gratitude on behalf of our organization for stepping in and for all you've done for us. We'll be forever grateful for the impact you had on our COVID response. With that, I would like to transition to my colleague, Ramona Brazil, Co-Director of Prevention and Wellness.
Hello, everybody. First, I would just like to take a moment to acknowledge a loss in our community. Almost 20 years ago, when I began working in public health, I met a giant named Billy Osborne Fears, the executive director of Starting Point. If you work in health and human services in a county or a state, then you know her name. But if you have ever had a child in a childcare setting in the last 30 years, then you know her work. A life that has impacted millions of children. At Starting Point is our region's childcare resource and referral agency. No matter if you were looking for childcare, you had a young child with special needs in childcare, or you are a family childcare home, you had a fierce advocate in the room. Billy commanded a room, and anyone who knew her knows what I mean. But her fierceness was in the spirit of advocacy for young children and their families. She would often just say, "We have to do this for our babies," and she was right. She understood the importance of high quality childcare for children and the importance of supporting their health and their social emotional development. When I look at my career and the people who I've learned from and wanted to emulate, Billy is one of them. So as the committed work of childcare advocates will continue in our community, I just want to share a moment and that my heart goes out to Billy's family and Starting Point in our community at large. Next, I just want to talk about schools for a moment as we continue to work with schools as they return to session. We have continued to meet with superintendents through our partnership with the Educational Service Center as they've continued to develop and implement their plans for school reopening. I just want to also personally share, which I got an opportunity this morning to share with them my own personal gratitude as a parent of a young child in school, all the efforts that they have taken and to put into place to keep kids safe while maintaining a meaningful learning environment for kids. That means a lot. And they take that duty very seriously. So I just want to talk a little bit about what we do and what they do when they learn about a new case. So once schools find out about a case that is reported in the schools, and that could be amongst staff and it could also be among students, they immediately work to exclude that staff member or student from the school environment. They then begin to identify a list of contacts who may have been in close contact with that person. And then they exclude those close contacts from the school environment for 14 days from their last date of contact with a person that was diagnosed with COVID-19. The contact lists that we have been receiving this week have generally been short. And to me, this is an indication of the due diligence that schools have put into place, measures to reduce exposures in close contacts. We then follow up with the case to learn more about their potential exposures and who they may have been around. And then we will work to contact those people who would also then need to be in quarantine. If multiple cases are reported in a school, we will work to see if those cases are related. People should not, as we start to see more cases and more schools come back, people should not assume that more than one case reported in a school environment is an indication that COVID is spreading at that school. Those details are determined through the case investigation process. It is possible that people have either independent exposures outside of the school environment, and then they just happen to also then be at school. It's also possible that they have a common exposure that occurs outside of the school environment. So those are things that we find out when we talk with people who've been diagnosed. Lastly, I just want to say that this week, cases have been more of a trickle than a flood in the school environment. The percentage of those diagnosed with COVID-19 under the age of 19 has remained steady. Of our total cases, approximately 7.5% are between the ages of 10 to 19 years of age, and approximately 2.5% are 9 years old and younger. And we have not seen that change with the opening of schools to date. We hope that that stays that way as more schools reopen. And with that, I'll turn it over to Johnny.
Thank you, Dr. Collins, for the kind words. I echo my appreciation to the CCPH staff. They've done an incredible job throughout this entire long pandemic season that we've had. So I wanted to talk a little bit today about the recommendations, the framework that we put together for school leaders.
Dr. Rose,
Yeah.
we can't hear you.
How about now?
Yes, we can hear you now. Thank you.
Strange. Okay. All right. Shall I start over? All right. Thank you, Dr. Gullett, and thank you, Ramona. The staff at CCBH has really been incredible throughout this entire ordeal for months and months. They've just worked tirelessly for this community. So I wanted to talk a little bit today about the framework that we put together at CCBH for school leaders to use in decision making around returning to school. The school leaders have an incredibly tough job trying to balance the risks associated with COVID with the very significant need to return to school. And so what we tried to do was to really review the best evidence and the guidelines from the state, from CDC, from WHO, from the scientific literature, and try to put together a framework that they can use in decision making. So what we tried to do with this was to tie together well-recognized indicators of COVID activity and risk in the community with easy to follow recommendations for how to go forward with school. So what we did was to tie the Ohio Public Health Advisory System color coding as well as test positivity rates in the community with some established CDC models of different learning modalities. So corresponding to different levels of risk that CDC has put out there, sort of a lowest risk mode of doing school, a slightly less low risk mode of doing school, a medium risk, et cetera, on up. So we really tried to tie these together in a way that as the level of COVID activity in the community comes down, that we can get closer and closer to something resembling normal school. So we put together a this four scenario framework, 4 different levels. So scenario 4 is the highest risk, and it corresponds to purple. So essentially, if we're at purple, the recommendation is really that students need to be at home, period, and that's all the evidence suggests that that's really the safest course. As you move down to the lower levels, each one of these recommendations has a set of learning environment recommendations. So what we need to do in the schools, in the classrooms, recommendations around on-site temperature and symptom screening, recommendations about what should happen in terms of contact tracing and returning to extracurricular activities. So going down to risk scenario 3, which corresponds to basically a red, an Ohio Public Health Advisory System red with less than 10% test positivity in the community. We're still recommending that school leaders consider continuing school essentially all virtually, except for students who have special educational needs and where that really won't be effective. Now, as we move down to lower levels, so the next risk scenario is 2. And so this corresponds to being at orange for at least 4 weeks and having a test positivity rate in the community of less than 5. So if we're there, this is where we're recommending that school leaders should start considering a hybrid learning model where we're employing small cohorts, so as small as can be feasibly done, staggered schedules, alternating schedules, having some students still doing at home learning virtually, and we're really recommending that schools consider trying to minimize mixing between these cohorts, minimize sharing of objects, really adhere strictly to cleaning protocols put out there by CDC, and really only resume the lowest risk extracurricular activities where strict social distancing can still be observed. And as we move down into risk scenario 1, which is where we hope to be soon. Right now, we're in risk scenario 2. We just entered that risk scenario, having been at orange now for beginning of the 5th week, as Terry mentioned. But when we're able to move into risk scenario 1, that's where we recommend that school leaders can really consider much more in-person learning, where most students are doing in-person. Cohorts don't have to be as strictly small. There can be more mixing, that sort of thing, and then resuming more and more extracurricular activities. So So in closing, the thing that we've really learned about this is that what matters in the community a great deal is, if in schools rather, is the mitigation measures that they can take and the amount of circulation of COVID that's happening in the community. Schools and students, we thank them, we applaud them for the diligent job that they're doing with these mitigation measures. And we ask that community members also continue being diligent to minimize transmission, wearing masks, social distancing, hand hygiene, all of these measures, so that we can keep these kids in school as much as possible. All right, and with that, I'm happy to take any questions once we hit the question phase.
Thank you, Dr. Rose, and thank you to all of our speakers. So we will now open it up for any questions that there might be. Okay, if there are no questions, I think Jerry had a few. Oh, sorry.
I have a question.
Yes.
Hi, this is Melissa Reed with Fox 8 News. Today, the ODH released their guidelines or guidance or recommendations concerning trick or treat. I know that Governor DeWine has said that it's up to each individual cities and towns and communities. Will Cuyahoga County be adding any additional recommendations? And also, what are your thoughts about the governor's recommendations today?
Thank you for your question. As I walked in the door today for this briefing, I was alerted by our Director of Environmental Health that the guidelines had just been released, so we need to read them. We'll take a look at those guidelines and make a determination as to whether we need to provide any additional information to support those guidelines. We certainly are interested, like the state, to make sure that trick-or-treating is safe in our community, and so give us a chance to take a look at those guidelines, and based on what the state has come up with. I know that there's been a number of local folks that have been providing input on some of the information. We'll make determinations on whether we need to have additional supporting information for our communities, and so we'll get back to you on that. Thanks.
Okay, thank you, Terry. Any other questions?
Yeah, this is Courtney Astaldi with Cleveland.com and the Plain Dealer. I was hoping to circle back with you folks. Earlier this week, the Board of Health spokesman said that you guys were looking to perhaps shake up the way you're doing some reporting related to kind of like primarily college students. There might be some issues establishing where their residents at. If they're going to college in Cuyahoga, they're not necessarily Cuyahoga County residents. I'm wondering what the change in reporting mechanism might be. And also, are the numbers we're seeing every week out of the Board of Health reflective of out-of-county students who are currently going to school within Cuyahoga County?
Thank you, Courtney. I can take this question. So yes, what we realized here is, as schools opened up, this is not dissimilar to the long-term care situation in terms of understanding the reporting mechanisms and the requirements. And so when we speak to K through 12, obviously we have guidance from the state on how that is to occur and how that will go forward through the state website. Colleges are a little bit different. We've been trying to figure out how to classify cases and working with the state health department for colleges as they began to open up. And as you alluded to, we know that there are a number of colleges certainly in the community here, some in the city of Cleveland proper, some in suburban Cuyahoga County, and there may be these students may be commuting to school from multiple counties into our community. They may be on site, and there's sort of a range of ways in which they may engage with extracurriculars or sports within those environments. So what we realized is that when we began reporting the data initially as schools opened up is that it's incomplete, because of course we only have data as it relates to students that are in our jurisdiction proper. So what we're seeing now is around the state of Ohio is colleges are standing up dashboards on their website that provide their most current data on the cases as it relates to their student population. And that's clearly the most efficient way to report the constellation of all of their students in the community in the surrounding area, and the way they interface through curriculum, through sports or extracurriculars. And so we know that the communication staff at colleges have those numbers, and we also know that the dashboards are providing the most up-to-date information. The other thing we've learned, as you asked about, is with students and residents. So we know that there has been some clarification on reporting. Certainly if a student is at a campus, at a college, and that is where they're living most of the time, that is, they're on campus, or they're even living off campus, but that is their residence during the school period. That is considered their residence. So if we had a student from a college, let's say, for instance, for the sake of discussion, a student from Ohio State, they happen to have a permanent family residence in Cuyahoga, but they're living on campus at OSU, or they're living just off campus at OSU, but that's where they're spending their time over the next semester, then we are transferring those cases to the jurisdiction, the appropriate jurisdiction where they reside. So that's a new process to be able to accurately reflect where an exposure may have taken place, to be able to track cases and look for evidence or concerns about clusters. So that's all part of this evolution, not dissimilar to the long-term care facilities, to begin to classify cases appropriately based on jurisdiction and based on the guidance, so we can provide as clear data as possible. Hope that helps.
Thank you, Terry. Are there any other questions?
I have one wrap-up comment, and that is that we have on our website the guidance, that framework that Dr. Rose described is available on our website, as is, of course, our data brief, and we have those data briefs weekly going back, I think, since the beginning of when we began meeting with County Executive Budish and having these updates. So the weekly data is there for you to review as well. So it was a great weekend.
Okay, thank you, everybody, and have a great weekend.